You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. Now, we've had him on the program before, and he is the go-to implant dentist in South Central Kentucky, Dr. Devin Hall. Dr. Hall, welcome to the program.
Thank you, Randy. It's good to be here.
Now, we've talked before, but you say nobody should be wearing a loose-fitting denture.
I don't believe anybody should be wearing a loose-fitting denture. That is from decades past. We have moved beyond it. We can improve people's lifestyle and health with the addition of dental implants to help secure new sets of teeth.
Okay, good. Now, for people that don't know your practice, like who's the typical implant patient?
We don't really have a typical patient, but typically they'll fall into one or two categories, okay? So either they're in the category of they've had a lifetime of patchwork dentistry, they've had cavities filled, root canals, crowns in place, broken teeth, just a totally broken down set of teeth.
Okay.
And they're looking for something that's going to be more of a long-term fix, okay? And most of those patients are afraid they're going to end up in a denture.
Okay.
And that's why they come to see us, because they don't want a denture. They want something that is better.
Okay.
The other group of patients are the patients that have already been wearing dentures. They're already denture patients, okay? And they may have been for 10, 20, 30 plus years. And they've had these dentures for a long time, and finally, they just get tired of teeth not being hooked on to anything, right? They're not attached to anything.
Yeah.
They get tired of their denture, and they're ready for something new. Maybe they've heard about dental implants. Maybe they're just looking to see what else is new out there.
It's becoming very mainstream, right?
It is becoming
in Kentucky,
more mainstream.
the word's on the street that this is the new way to do it.
The word is out.
Is that right?
The word is out, and I think part of it is because people have now had the procedure done. They've seen the results themselves, and then they start talking about it. They start telling people about it. Because that's where we get a lot of patients who come in from previous patients who we've already treated. And they could come from all over South Central Kentucky, right, to come see us in Bowling Green. They may be coming from Franklin, from Morgantown, from Scottsville, from Glasgow.
You said up to like an hour plus away.
Yes, we have patients that frequently come, an hour or away to come see us because we offer, kind of cutting edge dental treatments.
You guys are known for sedation too, right? I mean, you're big on IV sedation.
We're big on IV sedation. We love doing IV sedation because we have patients who come in who haven't seen a dentist for 20, 30 years out of fear.
Right? Okay.
They're afraid of pain. They mentally go right back to some experience as a child with the dentist, and it's painful, or they felt like they were being held down or being forced into treatment. These are deep-seated fears that we deal with, and we see patients every single day to come to us because we offer IV sedation, because we can offer them comfortable treatment.
And you guys have been like early adopters on this sedation thing, right?
Yes.
I mean, you've always done that.
Yes, it's kind of a hallmark of our practice. It's really one of the things that our practice is even built on, is sedation treatment.
And it's safe?
It's very safe, yes. IV sedation is very safe. A lot of studies even show
what do you monitor?
Blood pressure, pulse, EKG, heart rhythm. So we know the patient is being well taken care of.
Okay.
They're safe, they're comfortable. There are studies that even show a sedated patient, because they're relaxed and we're relaxing their nerves.
Okay.
That is a safer way to treat the patient than if the patient was fully awake and kind of on edge.
Makes sense.
Okay. So we're able to relax them and keep them really comfortable for long procedures. A lot of times we're making up for decades worth of treatment and dental disease.
Is this true though that some people they come in like the denture wearer? Correct me if I'm wrong here. On the day of the procedure, a denture wearer can walk in with no upper and lower teeth, walk out with upper and lower teeth. That don't even come out.
That is exactly right.
Okay.
So we have a treatment we call sudden smile, and the patient can walk in with either the teeth that they've been walking around with for years, that they hate, that they don't like, that don't work well, that don't look good, they hate their smile, they hate what they can't eat with them, right? They walk in with these teeth, we do the procedure, they leave with a set of teeth that are actually screwed into place into dental implants. They are fixed into the dental implants.
Sudden
the patient
smile.
cannot remove them. They cannot take them in and out. We can, but the patient cannot. And they come in, and the reason they think they are the worst is because people all over the area are walking around not smiling.
So they hide it.
They're hiding it.
So they don't know it exists.
They have the same issue that the patient in the chair now has. It's just this one is now in the chair in front of me talking about it. The other people walking around town who hate their teeth, hate their smile. They're just not showing their smile. They're just not showing it. So these people think they're the worst when in fact they're one of many. There are tens of thousands of people in our area who are missing all of their teeth, are denture wearers, or are on their way to needing full tooth replacement.
Now, is it true, like sometimes on a consult, I think you told me this, I'm going to paraphrase, but you may be on a consult with a patient and they've decided to move forward with this, but they don't even know how good this is going to be.
And that's what
like
makes
they just think
me,
it's what, better chewing or something, but it's more than that.
And so often when I'm in these consultations with these patients, I get so excited when I'm with them because I can see the end, right? I can see the end point. I can see their smile at the end. I can see and just feel what they're going to be able to do afterwards compared to what they do now. They're going to eat better foods. They're going to eat more foods. They're going to eat the foods they want to eat instead of the foods that they can, physically chew with their bad teeth. They're going to be smiling, bigger.
So is it a self-confidence thing that comes back?
It is a self-confidence. It's a self-confidence. Studies show just how important smile is, right? A person's smile is so important.
I knew you were going to say this because you're a dentist.
Well, yes, of course I am a dentist, but everyone knows this.
Okay.
So if you can be walking around the street, you see someone smiling, what do you think about that person?
Like they're friendly and approachable, I guess.
Good mood. You think about them a little bit differently, right? They're showing more of their personality. If someone is walking around with a scowl on their face, studies show us this. If someone's walking around with a scowl on their face, people automatically judge them as being angry. If someone walks around with a frown on their face, people automatically judge them as being sad. If someone walks around with a smile on their face, people judge them as being happier. And
so they're treated differently too.
I mean, they're treated differently. It actually improves interpersonal relations.
Okay.
This is where really psychology comes into it, because a person's smile will, it's kind of the window into the person's personality, right?
Okay.
And when patients come to us and they're very reserved, when we're finished with treatment and they have their new smile, they become a different.
Are they almost unrecognizable sometimes? Like you see them 6 months later?
Sometimes they are, yes. And it's not that.
It sounds like an exaggeration, by the way.
But
it's more than just teeth, as you say.
It is more than just teeth.
I guess if something bothers you, it's going to hold you back.
Yeah. I get the pleasure of working with the patient to give them a new set of teeth and a new smile.
Good.
But what I never knew for so long is by giving them and being able to give them that smile, I'm going to help restore the personality, their true personality, because their personality's been there.
Do you hear that from family members or spouses?
Yes.
What they say?
Because spouses will frequently come in a lot, and I mean, I've got a patient who he just never smiled, right? And his wife just said, I've told him for years, I want to see him smile. I want to see him smile. But he hated his teeth. His teeth were in bad shape. He had bacterial infections. They're broken down. He didn't like his smile, so he never smiled. But his wife missed his smile, and we were able to give him that smile back. And now he smiles without even thinking about it. And to me, that's one of the biggest compliments that I can receive from patients, is that, when I sit down at a restaurant and I look at a menu, and I don't even have to think about how hard the food is going to be to chew, and it's just natural, I want a steak.
Just get it.
I'm going to order the steak. Or when I'm at a party, or I'm at church, or I'm in close contact with people, and I'm not having to worry about my smile. I just don't even think about it. I used to always guard it. I used to always cover it up, hand over the face. COVID was an interesting thing because people were wearing masks. People would come in and say, I noticed I was smiling more when a mask was covering my mouth.
That's interesting.
That now masks are off, right? No one's really wearing masks. And now they're reserved again. They're hiding their smile because now people can see it. I brought some photos with me because everything that we've been talking about applies to these people.
All right.
These are patients that I've helped, give them a new smile, a new set of teeth. This patient, she came in, she's sweet as can be. She hated her teeth. Okay. She had a bacterial infection that was, made these teeth kind of beyond being saved.
So you can't really brush and floss out.
You can't brush and floss. There's nothing that she's going to be able to do at home that's going to help this situation. Okay. Right? So this is when we need to step in and be able to give her the options to be able to get her smile back.
Okay.
And so she came in, we had to, go beyond her teeth. Typically, she might go to a dentist and they give her the option of a denture. She don't want a denture.
So there's no way she would have got a denture.
No way she's wanting a denture. Okay. Look at her. She's
too young for a denture.
She's too young for a denture. She don't want a denture. And so she came to us because she knows she wants something else. She wants something that is not just a regular denture. So we came, we worked with her to give her a new smile, a new set of teeth.
Very nice.
These teeth are locked into place with dental implants. And she can eat whatever she wants. She can chew whatever she wants. She smiles. She's got a beautiful smile. Totally changed her, appearance.
She looks
Randy,
happier.
Would you say she looks happier, healthier?
Yeah, that's for sure.
More vibrant.
Yes,
and
yes.
Just overall more beautiful, healthier.
They look real. I mean, these teeth look authentic.
That's always my goal. When I'm designing a smile, I want the teeth to look natural. Like I want it to look like a natural smile. I don't want something to look fake. I don't want something to, when the person smiles, people know they've had work done, right? That's not what I want. I want to make just a beautiful smile, one that fits the person, a tooth shape that fits face shape. I want those upper teeth to follow that lower lip when they smile. And the reason we can make these look so good is, they're partially designed on a computer.
Okay.
And we're able to try them in the patient's mouth. We make sure that we're happy with the result, make sure the patient's going to be happy with the result before we ever finalize.
Now, when they look at, like somebody like this, when they look at their face with the new teeth for the first time, what's that like?
Oh, it's a great experience. Sometimes they can't put the mirror down.
Is that right?
They look at all angles. They're looking at themselves differently than they have looked in years. So many times they've been so unhappy with their appearance that they avoid looking in the mirror, right? The last thing they want to do is stand close to a mirror and smile. They don't want other people to see it. They don't want to see it themselves because, really they're just too
still lightly sedated, but they're really emotional sometimes when they look.
Sometimes when they're, yes.
Are family members emotional when they see them?
Especially if it's teeth, right, that we put in, they have surgery and they're sedated, they can immediately look in and see the difference, It's truly unbelievable just how these patients react. The day we finished her treatment, I was in there talking to her.
Yeah.
And she looked at me, she was tearing up, and she just said, "Can I give you a hug?"
That's nice.
And I said, "Absolutely, you can give me a hug."
That's good.
That, to me, we're doing more than just teeth. We're allowing this person to show off the person that they are.
So they're back.
They're back.
Good.
They're back.
Good. Time for a few more.
Here's another case, Randy. This man came to us with teeth that have just really hurt him for a long time. Okay, they had held back what he was able to do. He wasn't able to eat the foods he wanted to eat, like a taco, a salad, crunchy things in salads, celery.
Okay.
Almonds. They're not eating nuts. They're not biting into a sourdough panini or a crunchy breads or chewy pizza or an apple. They're not biting into these things because their teeth are not allowed.
So this guy's teeth were so bad. Option was a denture. He could have had a denture.
He could have had a denture. He could have had a denture, but I really don't think that's why he came to see me. I think he was looking for something that was better than just a denture. Right?
Okay.
So he came to see me, and we discussed dental implants and how they could help his teeth be more functional, chew better, look better, feel more natural, feel more like his own teeth, just better, right?
Okay.
So we're taking his teeth, upgrading them to a full set of upper and lower teeth.
Okay.
That are secured by dental implants.
All right.
That do not come in and out.
Let's take a look.
Okay. And this is his result.
Wow.
He got a great result, and I love seeing him when he comes in. When I first saw him, he was a truck driver. He would drive cross country on long haul routes. His wife would always come in to his visits and see us too. And his personality changed. He became more talkative. He smiles constantly when he's in the office. When we're seeing him, smiling. His wife says he's smiling all the time. That's what she wanted him to do for years. But he wouldn't do it because he hated.
So now he's smiling all the time.
He's smiling all the time.
And
he can eat anything he wants.
Okay.
Yeah, he can eat anything he wants.
How old can you be to get this done, by the way? I've asked you this before. In your 80s?
Really, you can be any age. And we'll talk about some more patients. I mean, we have patients who are young to elderly.
Okay.
Because this is a treatment that can benefit all ages. It's not just one particular age. It's not just men. It's not just women. It's everyone. And depending on where someone is in their in their current state of their teeth and how they feel about their teeth, or how much pain or infection they have from their teeth, then it's an option that we need to give our patients.
I have a question. What if somebody in their 70s? I mean, statistically, 72-year-olds are on 4 medications. Can you be on like osteoporosis medications or type 2 diabetes medications and still get this done?
Yes, you can.
Okay.
Yes, you can. So people are oftentimes very nervous about some of those conditions, and we always check into the severity, right? And the medications that they've been on, and the medications that they're currently on, as also the diabetes, with how controlled or uncontrolled it is, because it does factor into how we approach the surgery. But we see patients every day who are on those medications or who have diabetes or other conditions that it's good for us to be aware of, because we do work with their physician to make sure that we're going to be doing things safely that are in their best interest.
Is it rare you have to turn them away and say there's nothing we could do?
It's very rare.
Correct me if I'm wrong on this one. So I guess how dental implants are typically done, especially in South Central Kentucky, I shouldn't say especially, but across the country, is you go to one doctor that does the surgery at one office, you go to another office where they put the teeth on top, and then you get them maintained at a third office. At your office, you do all 3 parts. Is that why you do it so quickly?
Yes. That is absolutely why we're able to do it so quickly and efficiently, because we
So you have the training in both the surgery and the other part.
Exactly. Okay. So, and when you have the training in the surgery, but we also have IV sedation to be able to safely and comfortably treat the patient, right? And we're able to perform the surgery, design the teeth, design what the teeth are going to look like, how they're going to fit together, how well the patient is going to be able to eat and chew and smile afterwards, right? Because every patient wants a good result when they come in. And then once the treatment is completed, then they're still coming to see us for maintenance, for x-rays, making sure that
So you just clean them just like regular teeth, right? Like every 6 months, every year, they just come in and get them cleaned.
We clean them like regular teeth. Dental implants can be cleaned just like regular teeth. And that way we're able to make sure that the patient is remaining in good health, and that the implants are stable, and they're going to have the smile for a lifetime.
But if you have bad gums, like really bad gums, can you still do this?
Yes, you can. And I mean, that's one of the reasons that many patients will come in to get this, treatment anyway.
So you clear up this gum infection, the gums get nice and healthy. What about the bad breath associated with this?
It's interesting you bring up bad breath. So I have a patient who's a man. He owns his own business. He came in. We performed. He came in with a denture. Okay. He had a denture for a long time. Just a regular denture, and he hated the adhesive. Tastes awful. This is what he's telling me. Right. He can't eat breads because it sticks to the palate of the denture. He can't chew gum because it sticks to the plastic of the teeth. And he has a lot of dry mouth problems because his palate is covered by the denture. So he was ready for a set of teeth that are secured by dental implants that are locked into place that he can't take in and out. It opens up the palate, he gets more taste back, he gets his good salivary flow, less dry mouth, he can eat what he wants. You mentioned bad breath. He actually told me his breath has improved after having the procedure. So going from a traditional denture that covered the palate, that took up a lot of space in his mouth, now he has a full set of upper teeth locked into place on dental implants. Bad breath has gone away. His confidence, he said, my confidence has gone from a 5 out of 10 to a 9 out of 10 just from getting my teeth done. Nothing else has changed, just from getting his teeth done. So before he said, my steak eating was a 3 out of 10. Now my steak eating is a 10 out of 10. If I could live off steak, I would just eat it every meal. So he's eating steak, he's eating corn on the cob, he's eating beef jerky. Beef jerky, frequently. Patients we'll see him the next day after the surgery, and they've maybe taken one pain pill, maybe they've only taken over-the-counter pain medication. That is it.
So for some people, it's just easy for them.
It is. They do remarkably well, and I always enjoy kind of getting to talk to them about that, because typically they're very pleasantly surprised with how comfortable they are. It's pretty unbelievable.
So we probably have a couple of minutes left, and I know you have more photos, so I'll kind of rush you a little bit.
Okay, well, let's go through some. This patient came to me. She's young, her teeth are unhealthy. She doesn't like her smile. She doesn't like, see, when she smiles, you can see the dark, places up at the top around the gum lines. So she would never smile really big because, you could see those cavities that were on her teeth. We couldn't save these teeth.
Okay.
So we had to move beyond. A lot of times people would just say, well, you just need a denture. Well, that's not what she wanted. She wanted a new smile that would also allow her to eat what she wants to eat.
It looks nice.
Yes, it looks great. Look how much younger, healthier.
It's true.
Would you say she's more attractive?
Yes.
And that's for men and women. Men become more handsome, women become more
Teeth
beautiful.
just make you look better.
They just make you look better. They make your face light up.
I'm not trying to side with you, but I think the photos prove it.
The photos prove it.
Yeah.
It's a beautiful result for her, and she is so happy when she comes in with her new smile. And she's just a joy to be able to have as one of my patients. Here's another case, another patient that I've treated. Look at his smile. It's reserved, right? If you looked at him, you may just think he's a quiet guy. Right?
Okay.
He's not.
You said you have to
very
kind of
talkative.
force him to even smile like this.
It is, because
they like
so
to have their
often
mouth closed.
They've been hiding their smiles for so many years that they don't even know how to smile anymore, right?
Okay.
So we are able to give them a new smile, and they have to learn how to smile again. Sometimes they're still kind of guarded with their smile right after treatment.
That looks good.
But then they become more of themselves. I love this photo of him because this is his personality. He is an absolute blast when he is in the office. He is cracking jokes. He is just laughing and cutting up with our team, and he is so fun.
And so he can eat whatever. I mean, could somebody like this eat a steak? Or
Yes, they can eat steak. He left the office one day, and he was gonna go try out some good food at a steakhouse. So oftentimes we see these before and after photos, but sometimes they don't really show the patient's personality, right? That's why I love this one so much, because that is his personality.
So you may have misread this guy when he first came in.
I absolutely.
You didn't know he had such a big personality.
I would have never known that this was as big of a personality.
Because
as
every
he was
time,
gonna
look,
have.
I've said this earlier in the show, but every time you come on, I think this is our third time I've interviewed you, but every time you're more excited. And I asked you that in the green room. And you said, because I've done so many of these, I see how good it is for these people. Is that pretty much?
It's exactly right. And when the new patient comes in for an initial consultation, and we're just kind of talking about treatment, or they're asking their questions about treatment, what hasn't hit home with them yet is that this is what we're working towards. We are working towards this new smile.
It's going to be big.
It's not that we're giving him a new personality. We're not doing that. We are just helping give them a new smile that
giving him his
allows
confidence
them
back?
to the confidence to
charisma.
show the personality that's always been there. The personality's always been there. It's just maybe it's just not been shown enough with people that they come into contact with day to day.
Now we got about a minute and a half left, and you still have a bunch of photos there.
Yes.
So I'll rush you.
These are all people that would have been in a denture.
Okay.
But they didn't want to be in a denture. They want something better. She came in, teeth that were simply failing. We couldn't save these teeth. And her concern was just overall health. She felt like she was unhealthy. She couldn't eat what she wanted to eat, and she felt like that was making her more unhealthy because she wasn't able to eat what she wanted to eat. She came in, now she has a set of upper teeth that are on dental implants, secured into place, locked into dental implants, and she can eat really what she wants to eat now. It's great. He came in, working with the public, wanted to be able to smile, but he never smiled. Why did he never smile? Because he hated the way his teeth.
And you saw the end result with this guy on the console.
The end result.
Like you said, boy, this is gonna be good.
I can picture it in my mind,
Okay.
But sometimes, even what I envision, still don't, know exactly how good it's going to be for them.
So last photo.
Yes. So here's a guy that came in simply with health issues, and they had taken the way that they just destroyed his teeth. And
so this is not just from not
uncomfortable.
brushing your teeth.
No, this. There are health concerns that come into play that really
kind of mess up your teeth.
Mess up the teeth.
Okay.
And so patients all the time will come in. They'll feel bad because they feel like we're going to get onto them because of their health or their teeth being unhealthy. But dental disease is not always in the patient's control.
Okay.
Right?
Okay.
So, and that's one of the things that we want to comfort patients when they come in. We're not going to criticize, and we're not going to get talked down to them. We want to come up with a way to help them. And that is our goal. He came in with a health problem and it just destroyed his teeth. He was ready for new teeth. He ends up with upper and lower set of brand new teeth, a brand new smile.
That had to be big for him.
Locked onto dental implants. Just look at this end result.
Handsome guy.
Handsome guy.
He was handsome before. He's more handsome in the after.
Well, and confidence, more put together. Look at that smile. Young guy. He's way too young for a denture. Right, way too young for it.
But as you say, everyone's too young for a denture.
Everyone's too young.
Even if you're 90.
No one wants a denture. Everyone should have teeth that are locked into dental implants because that's going to give them a more natural feel. It's going to give them more natural chewing ability. It's going to give them more confidence. They're not going to be afraid the teeth are going to be flying across the room when they're speaking or at a ball game yelling in the crowd. You know, they're not going to be afraid the denture is going to come out then. Everybody needs to have a set of teeth that are locked in with dental implants.
So what is your final message? Okay, so there's two groups of people, as you pointed out. People still have teeth, but they're so bad, they may end up in a denture. They don't want a denture. Or the other group that are currently wearing a denture, that never go to the dentist, so they don't even know their options. But let's say they're watching this. Maybe they've seen you for a couple of years being interviewed about this, and they're still skeptical or afraid. What do you say to them?
I say, give us a call. Come in. Let us talk with you about your options, what we can do for you. If you heard years ago that you didn't have enough bone for dental implants and so you've just been settling with your denture, that could be that single person's opinion who you saw years ago. We have new technologies now that are able to tell us exactly how much bone that someone has, what we have to work with. We have different implants that we can work with to be able to help those patients. We can always build bone if we need to. Don't stay away just because of something you heard in the past.
So at least come in just to know your options.
Come in to
it's a free consultation, right?
Yes.
We should mention, we have to mention this about Medicare doesn't really cover this. Medicaid doesn't cover this anywhere in the U.S. And even the best dental insurance covers a very small part. But you say people finance this procedure.
They do.
Like 80% of the time.
Yes. I mean, people finance this procedure all the time. And they allow it to, to get done in a way that fits their budget. And
I mean, you have to have okay credit to get the financing. It's not like you're carrying it yourself, right?
Right, yes. So it is based on credit, and of course, but patients do it all the time.
Okay, good.
So they're able to come in, we're able to help them, and they're able to make it in payments in a way that are comfortable for them.
Okay, Dr. Hall, I want to thank you for coming on the show. Always a pleasure. Good stuff. Great photos. So if they want to make an appointment, do they just go to the website, make an appointment there, or call your office?
They can go to our website. They can also call our office, make an appointment, and we would love to get them in for a no-charge complimentary consultation so that we can discuss their options, so that we can change their smile.
Do they get to see you on these consults?
They will get to see me, yes.
Okay, good.
Yes.
Good. Anyway, again, thanks.
No,
Great
thank you,
stuff.
Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.